for this hour after work. I hope that we get a lot of co-creation out of this. So I have no disclosures, ethical or financial. So our objectives for today are to talk about how human health is intertwined with planetary health, to explore how planetary disruptions, specifically climate change, threaten lifestyle medicine interventions, and conversely, to highlight how the practice of lifestyle medicine presents an opportunity to improve the health, not only for individuals and communities, but also the planet. And I'm hoping by the end of this, we identify strategies to engage patients in behavior change if it is most salient to them because it protects their health, then that's wonderful. If there is someone in front of you who really resonates with the planetary health message, thinking about those messages as well when we're face to face with our patients in the clinic. So I've described my objectives, but my hope really is that we are together co-creating messages, communication strategies to really deliver not only the messages around the benefits of health when it comes to lifestyle medicine interventions, but also the planetary health messages, because we know that these prescriptions have co-benefits for both. So starting you off after a busy day at work with this very, very busy slide, this infographic is typically something that we show when we're communicating with anyone around greenhouse gas emissions and what are the downstream impacts on health. And I think if you are like me and like most people, you look at this and you feel overwhelmed. And I think that that is the feeling that most of us have when we even think about the problem of climate change or planetary health and our place in that problem. It is almost impossible to see ourselves as individuals, as health professionals, being able to make any impact as we think about all of these overlapping, interconnected challenges. And it certainly feels very difficult of bringing this into our exam rooms. So often does not feel like this is our lane when we're talking to patients. So I want to bring it to something that we all know and think of as in our lane. So this is a normal EKG, normal electrocardiogram. But we know that when that normal cadence and that normal rhythmicity changes and shifts, and we see this sort of pattern, we recognize that this is a medical emergency. When someone comes in with this type of signal on an EKG and symptoms of chest pain, shortness of breath, diaphoresis, we recognize not only is it a medical emergency, but we have a closing window of opportunity to save this patient. But we also know that we can come together as a team. We have the tools, we have the technology to save this patient. So now I'm going to shift us to something that many of us think of as one metric of planetary health. We can think of as a planetary EKG. So these are carbon dioxide levels over thousands of years, hundreds of thousands of years, in fact. And what we see as we sort of go back is 800,000 years of carbon dioxide levels from ice core samples. And we see it's not as beautiful or as precise as the EKG, but you might say that the planetary system is a little bit more complex, but we see some sort of rhythmicity. We do see ups and downs and shifts and changes in carbon dioxide in the atmosphere. But what we're seeing today is dramatically different and dramatically outside, a massive derangement from that rhythmicity that we have seen prior to over 800,000 of years. And what we're seeing along with this dramatic derangement are symptoms, heat waves, floods, wildfires. And we are more and more recognizing this as a health emergency. Also, again, with a closing window of opportunity to save, in this case, all of our patients, massive amounts of populations across the globe. But we also know we have the tools, the technology, and the knowledge to preserve health and to protect health. So I think I'm hoping that we can take this message and spread it to others, that we do have massive changes, massive derangements but also an opportunity to protect health. And so it is not just a growing chorus of health professionals that think that thinking about climate and planetary health is very much within our realm of responsibility as health professionals. This is a common thread among leading experts, journal editors from over 200 journals across the country, now calling in editorials over the past 4 years. So the first editorial came out in 2021. Most recently, there was an editorial at the end of 2023 sharing and sort of sounding the alarm that not only is climate change a threat to health, it is very much in our lane, and that we should be thinking about climate and the crisis in nature as a global health emergency. I think most people are aware of the concept of planetary health, which is sort of so bringing the climate crisis sitting within a larger crisis of health for the planet. I think most of us also are aware of the framework which scientists across the globe worked to develop estimates for sort of safe operating limits for a variety of planetary boundaries. Those planetary boundaries in green suggest that we are in safe operating range. As we get to the yellow and orange, we're in the zone of uncertainty, but with increasing risk of going outside of sustainable planetary boundaries. And those in red, a high risk of essentially living outside of what the planet can sustain. And back in 2009, we saw that with regard to climate change, the global nitrogen phosphorus cycle and biodiversity loss, we were very much operating outside of safe boundaries. Then 14 years later, when these were reassessed, these boundaries were reassessed, we see that for many, many parameters, 6 out of 9 parameters, we are living outside of sustainable and safe limits. So bringing the focus back to just one perturbation, if we're thinking just about climate change and the impact on health, this is one framework to consider how the impacts, sort of the downstream impacts on health, impact our patients, from the innermost circle reflecting climate impacts from rising temperatures, more extreme weather, the outer circle then showing those downstream impacts on our environments, air pollution, extreme heat, environmental degradation, problems with water and food access. And then the outermost area shows the downstream health impacts that occur because of the climate shifts that we're seeing. As we all know, we certainly are seeing extreme weather and climate impacts in the US. The United Kingdom, residents are already suffering from many of the climate stressors that are predicted only to worsen over the course of time. So I hope I have, and I'm sure that we are all in agreement that thinking about climate change and planetary health is very much in our realm as health professionals, and that we should be concerned about it in terms of protecting our patients. But I think that as lifestyle medicine or plant-based health professionals, we have even more reason to be concerned about these threats. So starting with our most foundational intervention for health and for planetary health, are nutrition prescriptions. What we're seeing as health professionals is that food access is already significantly interrupted with climate emergencies, extreme weather. So these are just some headlines over the last year in the US. Basically rotting crops, the cost of healthy foods, their very foundation of our prescriptions being exorbitant in some regions. And then in the UK, also a lot of evidence that farmers are struggling to protect the crops that we rely on as healthful prescriptions for our patients. And we recognize that this is not necessarily simply a problem locally, but it is a global problem, as our food supply chain is interconnected globally. So extreme temperatures, climate impacts, hurricanes, floods, droughts, wildfires in different regions can impact everything from production, storage, processing, retail, to consumption, and can so definitely impact the food security of our patients and the healthful prescriptions that we can provide our patients. Beyond that, here is very busy slide number 2. We're recognizing more and more that not only is nutrient quantity potentially diminishing, but so is nutrient quality. So this infographic is essentially showing us when we look at the impact of higher carbon dioxide levels in our atmosphere because of increasing greenhouse gases, soil nutrient changes because of soil degradation. I'm going to eliminate the internal sort of pathways, but what we see is essentially that for staple crops like wheat, rice, legumes, vegetables, there are decreases in the nutrient quality for our patients. I think very well-known research from Sam Myers out of the Planetary Health Initiative found that food crops, when exposed, like wheat, corn, rice, soy, when they're exposed to very high levels of carbon dioxide that are predicted for 2050, those plants lost as much as 10% of their zinc, 5% of their iron, and 8% of their protein content. So recognizing when so much of the world is already nutrient deficient, these types of losses in staple crops can be devastating for populations. And just to build on that point, we already know that half the global population is malnourished, whether it's 2 billion people that are micronutrient deficient because of undernourishment and food insecurity, and then the other 2 billion adults and children who are malnourished but obese because of poor nutrient intake in their diets. We're already dealing with half of our population, global population, being malnourished. So these types of threats to nutrient quantity and quality can be devastating. Shifting us to our prescription for physical activity. We're recognizing more and more that extreme weather events are making it very difficult for us to prescribe things like go outside and take a walk, exercise for 30 minutes outdoors when your outside is looking more and more flooded or experiencing extreme heat events. We're also recognizing the impacts on our sleep prescriptions. So more research showing that nighttime temperatures, when they're elevated, particularly in urban heat island areas, we are seeing more sleep loss, more difficulty staying asleep, and more difficulty going to sleep. So there is another one of our prescriptions at risk. Stress management. So I do not need to, I'm sure, tell you, but extreme heat is associated with increases in irritability, depression, increased risk of suicide. It can also affect our behavior, contributing to more events of aggression, more incidences of domestic violence. And research is also linking higher temperatures to shifts in our memory, attention, reaction time. But it's absolutely linked to many, many exacerbations of mental health symptoms. And then our prescription for avoiding risky substances. We see more evidence that higher temperatures are linked in some ways with higher rates of drug and alcohol disorders. We certainly see higher risks of substance abuse after prolonged and repeated episodes of extreme weather events. And then social connection. We're seeing more and more devastating extreme weather events that are leaving communities bereft and either making people climate refugees or creating communities that have to accept many climate refugees. Both can strain social connection. And it's anticipated that by 2050, 200 million climate refugees may have fled from their homes. Again, a huge concern when we think about our social connection prescriptions. So if I've convinced you that we have a message around health professionals being concerned about planetary health and climate change and bringing it into our work, if I have convinced you that as lifestyle medicine health professionals, we have to really be concerned about the impacts of climate change and planetary health on the foundations of what we prescribe, I think it's also important for us to think about the equity and ethical dimension. So this map is showing emissions from 1950 to 2000 on the top half. So what you see is the majority of emissions. You see a very bloated North America, a bloated Europe, and what you see on the bottom half of the map is where the biggest burden of mortality from 5 climate sensitive hazards, that where the biggest burdens are. So though most of the emissions came from those bloated regions in the top half of the map, what we see on the bottom map is where those impacts are most felt. So certainly inequitably distributed. I've updated that slide just to show that, yes, it is true that if we're looking at more recent CO2 emissions, China, US, India are at the top of that list, but per capita, we're still seeing outsized role of the US, of North America, Australia. So certainly an equity and a disproportionate impact story that we need to be thinking about. And taking it from the global scale, thinking about it at our local scale, also consider thermal inequities in our urban areas. So many of us have heard of the urban heat island, and what we recognize is that often those most vulnerable are repeatedly harmed. So even as we think about the health impacts of climate change, those who may struggle the most with being socially isolated, difficulty obtaining healthful foods, might also have the higher burden of thermal inequities. And this is a study done, sorry, I don't have the reference, I'll add that there, but a study done looking at mortality, hot weather mortality in London. And they found that the mortality was highest on the outskirts of London due to disproportionate older age. So higher proportion of residents who are elderly. So I think the story, so we have many reasons to think about, as health professionals, the impacts of climate change and planetary health on our patients. And I think that when many of us think about what we need to do, the story that we often think about is a world rapidly transitioning to renewable green energy, and absolutely very crucially important. But what we can imagine is we make all of these changes and we make all of these shifts, and we still come out on the other side, perhaps addressing planetary health and climate change, but still unhealthy, still with massive health disparities. So when we look at the prescription that many of our esteemed health professional organizations across the globe have looked to create healthy, equitable, climate resilient communities, and I would add culturally sensitive communities, what we see, whether it's the Lancet report, WHO, National Academy of Medicine in the US, the IPCC, that there are certain strategies that offer co-benefits for climate and health and equity. And luckily for us, they all sit squarely in our wheelhouse. So we really need to be the disseminators of this message and spreading these prescriptions. So we'll dig in a little bit now to the good news, to the power of our prescriptions. So this comes from a group called the Project Drawdown, where they looked at the 100 most powerful solutions, not just to sort of plateau carbon dioxide levels in the atmosphere, but to start drawing them down, bringing them down to safe ranges. When they looked at those 100 solutions, number 4 on that in terms of most robust, most potent solutions was shifting at a population level to a more plant-rich diet. And what we recognize is that food systems, within food systems, up to 26, and by some estimates, up to 34% of emissions come from our food system. And most of these emissions are related to feeding farmed animals rather than feeding people directly. So looking at that data another way, breaking it down by greenhouse gas emissions across the supply chain for a variety of food products, we see that farmed animals by far have the largest emissions footprint compared to plant-rich foods on the lower end of the spectrum. I'd like to just also point out and note that land use and farming practices are the biggest contributors. And so often we'll hear about people being very concerned about transport and the packaging. Should they buy local? Should they buy something that is imported? Important questions. I'm not saying that they're not, but by far it's what we eat. So whether it's plant-rich versus meat-heavy, that accounts for the largest part of our own personal food carbon footprint. And unfortunately, the trends are not going in the way that we hoped. In the 1970s, we had much lower meat consumption per capita globally than we're seeing since. So the trend, unfortunately, is not in our favor. And then just one quick word on cow burps, because this is often something that people will say to us to diminish the message and the importance of addressing greenhouse gas emissions from farmed animals. So just if somebody does bring this punchline up to us, we can sort of reflect on the fact that it's not a laughing matter, because what we're thinking about is methane emissions. And animals that chew their cud emit an astounding amount of methane emissions. So we know that methane is 80 times more powerful as a greenhouse gas than carbon dioxide over the span of 20 years. So when we think about the fact that so much of these ruminant animals are producing methane, and then let me just show you. And when we think about the fact that we have completely shifted what life on this earth looks like, mammals on this planet, we are not necessarily thinking about a very small impact. So one adult cow can belch up to 500 liters of methane a day. So if you add all of that together, experts say that nearly 15% of total global greenhouse gas emissions come from the one thing that people often like to minimize. But as we know, food and our food supply system is critical at the intersection of human and planetary health, not just because of greenhouse gas emissions, but also when we think about much more than our carbon footprint. So food production also plays a major role in our fresh water use. So over 70% of fresh water use. It's a prime driver of deforestation, massive driver of land use change, the largest contributor to biodiversity loss. And what we recognize more and more that if we are to meet at least a goal of less than 2 degrees, and if we feel that that is a worthy goal to reach, we cannot do it without addressing the greenhouse gases from our food sector. And this is just information showing a graph that shows that if we are to shift to what I'm sure many of you already know about, the Eat-Lancet Commission's targets, then that type of shift can help us meet emissions goals. Without that shift, even if we were to completely shift energy, industry, buildings, transportation, we still would not reach targets. This is, I think, something else that is very helpful in the conversation when we think about not just emissions, but global land use for agriculture across different diets. So if we think about our current diet at the very top, just shifting to a no beef or mutton diet at a population level gets us to about half of the land use that we currently use, allowing the rest of that land to potentially be rewilded and become a strategy to help us improve planetary health versus what we're doing currently, which is to continue to degrade it. No beef, mutton, or dairy brings us to about 1/4 of the land that we are currently using. So massive benefits. So this has led us as an organization, the American College of Lifestyle Medicine, to make a very strong statement about diet and climate and recognize that the link between chronic conditions, the chronic disease crisis, and the most pressing global sustainability crises are interlinked. And by shifting towards a plant predominant dietary lifestyle, we can address both problems. And so when we're thinking about realistically, how do we make this type of prescription salient in our offices, thinking about, and I won't spend too much time on this, I'm sure most of you are familiar with the Eat Lancet dietary guidance. I will just point you to a very recent study that just came out this past Monday, the most robust data so far on looking at a large group of people who were living a planetary health diet lifestyle versus those who weren't. 30% less likely to die prematurely versus those at the bottom 10%. And they also found that shifting towards this type of diet would cut land use by 50%, greenhouse gas emissions by 30%, and fertilizer use by 21%. So what much that we can do in our office is to help people shift toward this type of diet. And again, it does not need to be a vegan or vegetarian diet. People can still have, as culturally appropriate, some red meat, seafood, and dairy in their diets. And then I'll just give a very quick nod to plant-based meats. We often get questions about that. Can that be a part of a healthy and sustainable diet? So I think that we can talk more about this at another time, but essentially the way it comes out right now in the wash with regard to the literature is potentially sustainable. Really cannot say that this is a healthy alternative. And we know that ultra-processed foods are bad for health, but there is more and more, and this comes from work by Frank Hugh, that this type of ultra-processed foods are also bad for the environment when we think about packaging waste, plastic pollution, over-reliance on a few crops such as corn, wheat, and soy, impacting biodiversity loss and deforestation. So we have many options that we can give our patients when it comes to dietary strategy that can promote their health, their longevity, and improve the health of the planet, whether that is a Mediterranean diet, an Okinawa diet, Nordic diet, or the planetary health diet. We can certainly help people find culturally appropriate shifts to benefit their health and the health of the planet. But we have 5 more prescriptions to fly through. So I will shift us now to a physical activity prescription. So I'm sure in the UK and Europe, you're well ahead of us in the US, where many of our cities are not walkable and we do not have the option for active transport or public transportation. But we do see that obesity rates are 20% lower, diabetes rates 20% lower in some studies in those cities that had the highest rate of active transport compared to those with the lowest rates. So one way to think about introducing this prescription with a climate and planetary health lens is not just to advise people around the physical activity guidelines, but also to think about what can they swap, just like we would think about healthy food swaps, think about active transport swaps, where they might find errands that they are doing within a few kilometers of their house, and shifting those to active transport, helping people identify SMART goals around that can be a great way to bring in a lifestyle medicine prescription that is healthy for both the person in our office and for the local community. And now a short description about our third prescription, avoiding risky substances. So we've talked about climate change as a stressor and a driver potentially increasing or putting people at risk for increasing substance use at a population level. And we see that according to the global burden of disease risk factors, tobacco is number 3, alcohol is number 9, lower down, other substances number 14. But what I would like to point out to you all is that air pollution is number 4 with regard to being a leading risk factor for death across the globe. So I think of air pollution as another risky substance that I counsel my patients about. So this is just, again, a busy infographic, but showing us in the black boxes where these air pollution comes from. So from transportation, power plants, wildfires, agriculture, and the impacts on the chronic conditions that we are trying to treat with our lifestyle medicine plant-based prescriptions are also exacerbated and linked to air pollution, from stroke, cognitive decline, heart disease, type 2 diabetes incidence, and prevalence. So in terms of a climate and health lens in our offices, when we're thinking about counseling our patients around risky substances, can we also think about counseling our patients about the health impacts of a risky substance like air pollution, and helping them think about strategies to protect themselves, from the simple to monitoring air quality alerts, potentially having HEPA filters in their homes. So something else I think many of us are starting to think about doing in our offices. Another is, as we talked about earlier, shifting to active transport. So in this study out of Sweden, they modeled looking at people realistically who could, because of their health status, their commute time, could transition from a car to a bicycle, and they found just from the lower air pollution exposure benefits for mortality. So just with our 3 lifestyle medicine prescriptions, shifting towards a plant-rich diet, addressing physical activity, thinking about air pollution as a risky substance, we have the potential to make a massive dent in what we're seeing as massive risk for premature mortality across the globe. And in one modeling study, this was just looking at 9 countries by 2040, if we are to align our lifestyle medicine interventions and consider sustainable pathway scenarios that center health, we can, as we said earlier, show significant health benefits by these shifts to plant-rich diets, more physical activity, and improving the air quality of our patients. But we have 3 prescriptions left to go, and I promise I will fly through them in our remaining time together. So nature prescribing can be an absolute multi-solving prescription when we think about sleep and stress management prescriptions. And we also consider the fact that, as particularly in urban areas, many of our patients are living in heat islands and may be exposed to a lot of noise pollution. So thinking about green and blue spaces, which show that there is significant benefit for lower cardiovascular disease, lower hypertension, diabetes, dementia onset. We know that studies show that urban green and blue spaces often also allow for social connection, physical activity, cooler air, so that they can prove beneficial for nighttime sleep and lower noise pollution. And we know that trees have enormous power also to provide massive planetary health benefits. So not only by reducing carbon dioxide levels in the atmosphere, but also when there are episodes of um, extreme flooding, helping with storm runoff, absorbing certain types of air pollution. And this is just one example from Atlanta, where I'm from. And then our final prescription is one that I think is so critical in a climate chaotic world, social connection. So more studies showing that those who are socially isolated or living alone without strong social connection, a higher risk for, excuse me, for death than those who have strong social ties in the event of climate emergencies. So those are our 6 prescriptions. And then I will just give a nod to one final piece, which is if we look at this pie of US healthcare emissions, we sort of zero in on this segment. This is pharmaceuticals and chemicals. We have, I think, as lifestyle medicine providers, a lot to offer, and this is an emerging area of evidence to address with our lifestyle medicine prescriptions more prevention, potentially opportunities to de-prescribe and lower our carbon footprint through that mechanism. And this is just, I think we owe a huge debt of gratitude to the work of the NHS and the health professionals in the UK who have been looking at carbon emissions by sector well before we had done it as well as you all. So I think, again, if we look up here and we zero in on the 20% of our greenhouse gas emissions from medicines and chemicals, I think more to come on how this may be, how lifestyle medicine may offer us an avenue to potentially de-prescribe and lower our carbon footprint with regards to the healthcare sector as well. So I will stop there. Please do stay connected. I'd love to learn more about the communication strategies that you have that you've found to be most useful when talking to your patients or talking to others. I love talking to everyone in like-minded communities, but I think it's so important for us to think about what of these messages are helpful to expand our zone of influence. So we'd love to stay connected. And with that, I will stop there and see if there are any questions, comments, or other thoughts.
Amazing. I think everyone was so absorbed. We haven't had any questions come in yet, but I'd love to know a little bit, whilst I give everyone a chance to please do ask your questions using the Q&A function. Would love to know a little bit about how you became interested in this. And you live in Georgia, which is obviously, you know, it's a part of the US that isn't, it's quite different to sort of New York or being in Boston or whatever. I'd love to know like your experiences in where you live and how you got into this field.
Yeah, I think that for me, I came to sort of thinking about planetary health and climate change before I came to thinking about medicine. I think my spiritual tradition growing up really was one in which we thought about so we didn't have health insurance when I moved to the US. I came actually from the UK where we were part of the NHS. And when we came to the US, we didn't have health insurance. So my only foray and experience with healthcare was thinking about food, physical activity, sleep as medicine, Ayurvedic sort of things as medicine from my mother and my father. But what they really instilled in us is that we're really connected to the world around us. So I think that really informed everything that I then went on subsequently to learn about medicine, was to think about some of these foundational elements and how it's just multi-solving. It's beneficial for us and it's beneficial for the planet, and things that harm the planet also harm us as well. I trained in New York. So, and I trained in the Northeast of the US. So it was definitely an environment that allowed me to think about these things and talk about it more openly. And so I've just been able to transplant that to Georgia and in the US and find other like-minded folks here as well.
Thank you so much for sharing that. And yeah, definitely really resonated with what you said about your upbringing. Your talk was absolutely brilliant. By the way, one of the comments that came up in the chat was just to read it out. It's from a dietitian in our group. Such a great talk, really clearly laid out. I'm doing a presentation with a very similar title for NHS staff in a few weeks, and this has been hugely helpful. Thank you. One of the comments or questions, I found it really interesting that air pollution has such a big impact on disease risk, more than diet, only just below tobacco. How can we advise patients about this when they may not be able to move, for example? I say this living in London with lots of cars going outside my window.
I'm sorry, I've lost your screen, so I'm just gonna, yeah, I think that one of the things that I find really powerful about talking about air pollution is that unlike other risky substances or toxic exposures, no one is going to fight you on wanting to be exposed to it. Most people just don't recognize how detrimental it can be to their health. But when you sort of can bring in the evidence and say, we can do a lot of shifts, we can make a lot of changes, you can do a lot of things differently in your home. But one of the biggest things, unfortunately, is that just because of the way that we drive around in our communities, just because of the way that we currently have our energy infrastructure, we're kind of being forced to smoke a lot of or ingest a lot of these exposures. So then putting out those recommendations. And I think what that in terms of monitor air quality, try to get a HEPA filter in your home. And I think it does a couple of things. One, it makes people aware that this is a health risk for them, so they can do small things in their home. But two, I think at a higher level, it makes them think about, well, why is my family being forced to be exposed to this? And so if they then have the bandwidth to sort of think about electric vehicles coming into their community, which is a big fight in the US. I don't know how that is in the UK. There's more likelihood to uptake on those policies that will protect people from these type of environmental exposures. Hope that makes sense.
That's, yeah. You can track the air quality and things, and obviously you can write to your MPs and you can do what you can on an individual level to put pressure. Thank you for a fascinating talk. Do you have any tips on how to talk about these issues with fellow health professionals without being met with defensiveness or apathy?
Yeah, I think that it starts with thinking about what I love about the work that we're doing is that we can make a case for a win on so many levels. So whether it's the economic case, whether it's the health case, whether it's the environmental case. So I think that we sort of need to just think about that group that you are communicating with. If it's executives within a health system or it's other health professionals, is the winning case for them that there are massive health benefits for shifting towards lifestyle medicine prescriptions? If so, I would lean into that. So we now have, there was a review article that came out, and I'm happy to share that, 78 guidelines from all different medical societies, whether that's for neurology or rheumatology, orthopedics, where cardiology, endocrinology, clearly, where lifestyle medicine interventions, so shifting towards a plant-rich diet, is foundational for the prescriptions that we want to offer. So if that's the case, start there, and then we can always say, and then there are these other healthy side effects. So I would always lean into what you think is going to be most salient to the group that you're talking to.
Thank you. That's a great tip. Someone said, fascinating. By the way, the questions are flooded in, so I'm going to try and get through as many as I can. Fascinating, but also frightening. What do you feel is my role as a non-medical professional or non-medical person to mitigate this process?
What do you think is, I'm sorry, I missed that last word.
What do you think my role is as someone who isn't a healthcare professional to mitigate the crisis?
I think that what we're seeing in the data is talking about it and letting people know that this is something that is concerning to you, that you're actually paying attention to, makes other people recognize the importance of that. So we see a lot of evidence of when people put a yard sign in the yard saying, I'm composting, or I just got solar, that there is this sort of social license to then want to do the same thing. So I think that using that social license and then to also use the opposite to sort of take away the social license from polluters. I say it's not okay with me. I find this really scary. It's really bad for our children's health. Those types of things actually have been shown to, just having that conversation, have been shown to spread the uptake and the acceptance of making some of these shifts.
Super helpful. Do your values of modern medicine ever clash with your Ayurvedic values?
I think that I didn't study Ayurvedic medicine as a field. So what I have is just purely anecdotal. It's just something that my mom does when I go home. So I don't, it's not necessarily something that I know very much about in terms of being able to prescribe to somebody else. But what I take it is really the upstream. So what is the key points of this? Is that herbs, spices, foods, physical activity, thinking about your sleep. These things have had thousands of years of observational data for benefit. So how can I then sort of combine what I know of the evidence base and sort of the scientific paradigm within which I've studied to incorporate things? And so as I learn more about certain types of herbs, spices, and we are now seeing a lot more research being done on things like this. When I went to medical school, if you said that you practiced yoga, people would laugh at you. Now we recognize, with sort of using this sort of more Western scientific paradigm, that there are massive health benefits. So I don't think that I'm cynical about it, but I sort of take what I learn and try to find what evidence we have for benefit. I think you're muted, or
Thank you, thank you. Yeah, I wanted to prevent the echo. And someone said, thank you so much. Very informative and very well presented summary about human and planetary health. What are the challenges in your experience that lifestyle medicine faces today?
I think that it's always so gratifying when we all talk to each other, but I am still shocked by how hard it is. Forget the planetary health message, but even sort of the lifestyle medicine for health message, how hard that is. And I'm really fascinated to learn about how your experience is in the UK, but in the US, you still get a lot of pushback around sort of thinking about lifestyle medicine as your first go-to prescription. I think that is changing slowly, but that's really what I see as like the first hurdle that we have the evidence for health before I even get to sort of the planetary pieces.
Thank you. I completely agree, by the way. Fabulous talk and graphics. Thank you so much. Someone said, I briefly saw fish in tiny letters amongst the good foods for lifestyle medicine diets prescribing. Apart from the fact that there isn't much fish left in the ocean, what about fish versus plant sources of essential fatty acids, and what is doable?
So I think aquaculture is interesting to think about. So we certainly know that just in the same way that our other lifestyle medicine prescriptions are threatened, some of aquaculture is also threatened. What we're seeing in some of the in the studies, and right now I'm sort of referring to NOAA, which is in the U.S., the National Oceanic, so our federal agency that studies anything related to oceans. Is that aquaculture and the way they're sort of studying it has the potential to mitigate some of the climate challenges. So I'm just thinking of a study on kelp recently that it mitigates ocean acidification and offsets emissions. So I think that we're learning more about what types of aquaculture is going to be helpful in terms of helping us adapt in our coastal communities, help us sort of diminish our carbon footprint. So because we know that most of the carbon footprint from our food sector is coming because of our land use changes. So the land conversion of forested lands for agriculture, and the production of animal food. So we know that there's lower greenhouse gas emissions from certain types of aquaculture cultivars. I think we just need to really know more information, and because you can also have aquaculture done poorly where it is contributing to planetary health degradation. So I think that that needs to be studied more, and we need to really understand and optimize seaweed, kelp, those types of things that are beneficial for health and for the health of our planet.
Thank you. That's, yeah, really helpful. I agree. We need innovation in that area. I'm conducting an audit of a university's physio and occupational therapy course. What do you believe I should focus on? And do you have any tips for this kind of process to have the most impact?
So, I'm sorry, the audio was breaking.
It was someone is conducting an audit of a university's physio and occupational therapy courses. And so they're just wondering what they should focus on. Do you have any tips on the process and what would have the most impact?
Yeah, no, I think that it's really interesting. So there are certain specialties like anesthesia, for example, where these audits are really helpful in terms of identifying greenhouse gas emissions from certain anesthetic gases. When you're thinking about physical therapy and occupational therapy, consider plastic waste. So what are the waste that is being consumed in some of these practices? And I think we also have a lot to learn from developing nations where they don't necessarily have the same level of waste, but sometimes have the same health outcomes. So what does a practice look like in a region where they don't have access to all of these types of, gloves and other things that we're using? I think also thinking about transportation. So I think there's a lot of interest in doing some of these types of therapies through telehealth. So thinking about that with regard to greenhouse gas emissions, and is there a benefit without diminishing the quality of care that's being delivered?
Thank you. That's really good. And yeah, I totally agree. It's interesting that things like, having a reusable tote bag has been seen as elitist, but that's the way that how so many people shopped for forever in other parts of the world. It's absolutely mad, really. And since lifestyle medicine has roots in health promotion and illness prevention, shouldn't this be taught not only in medical training, but education and schools? If our children are brought up understanding this and their own responsibility to the future, this would surely make huge shifts.
I completely agree. I think that there are certainly initiatives that I know. I think ACLM is working on some of those for K through 12 education in the US. I imagine that that's happening in many places globally as well. But I think that I have been really excited. I have young children, and definitely in their schools, that is something they're talking about. Conversely, I will say that I am not very happy with the school meals that we have in the US, which are highly processed. I think that when we're thinking about our own children, sometimes I feel a lot of mom guilt, and I'm sure a lot of us have that to begin with, but that we're here talking about lifestyle medicine, and when I go home, that what she's been fed at school is just so much the antithesis of that. So I completely agree. I think we need to talk about it. I think we need to make these healthy foods by default in our schools, in our hospitals, in anything that is funded by our government entities. I think that would be a really important policy change.
Yeah, I completely agree. There are some great initiatives in the UK and that we're working with to try to change school meals, including organizations like ProVeg. I think we're almost at the last couple of questions. I think I'll quickly ask them because you've done an amazing job of getting through them. Is it wrong to include animal welfare in our compassion zone as healthcare professionals?
Yeah, I think that it is not wrong. I think, again, it's really a question. One of my other hats is as sort of like a health communicator, and I'm very interested in that. So the question is, what is it that is going to motivate, and what's your goal in that? So if it's really for you, and this is part of your identity, and it helps you, we know through studies that if health professionals identify as plant rich, or I'm a physically active health professional, or I have compassion for animals, we're more likely to counsel our patients around it. So I think that that's important. But the second piece is thinking about the audience in front of you. We also have a lot of evidence, and this is out of the US, that sometimes talking about the planetary health benefits of a plant-based diet can be off-putting to our patients. So it's the opposite effect. So in that case, it's really, I wouldn't necessarily even mention that even as a side effect, because we know that shifting towards plant-rich diet, for a lot of people, it interferes with their identity. It's very hard. Let's just put it that way. It's a very hard shift to make. So you want to lead with the thing that's going to be most salient to the person in front of you, recognizing all of these different risks and these different benefits.
Wonderful. And the last question, thank you for this very informative presentation. By the way, we've had so many amazing comments, and someone's just said it's great to promote the optimal. For example, the plant-based Eat Well guide, which is 100% plant-based. That's what we have in the UK. We adapted the NHS, the National Health Services plate to make it fully plant-based. And that can, just is really important to give people that information. So someone has said, we're really aware of how difficult some patients find individual behavior change, even when they're aware of some of these risky behaviors. How do you recommend that we as individual clinicians can start to affect more systemic change and make it easier for them, for example, to access healthy plant-based food, feel safe cycling, and so on? What can we do?
Yeah, I think that this is where we have to think of ourselves as health professionals outside of the exam room as well. So where there is a policy discussion happening. So for the US setting, if there's a city council meeting happening around rezoning that might help with more physical activity and more active transport, making our voices heard there, sending a letter, making a statement saying that these, as a health professional, these are the health benefits for our community if we do this. So I think that we as health professionals have to get more comfortable, not just sharing these messages in our zone of influence, so in the clinic or in our clinic settings, but also in communities, so that, just as the person said, that we can have more systemic change. At the city level, I know in New York City, the mayor is very involved. So he's shifted the health and hospital system, all government systems that he has control over, to plant-based by default. So these are the types of shifts that it would be great if you have access to someone like that to be able to make the case, because sometimes just sort of having that conversation and convincing one person can make it easier for entire communities.
Completely agree. Wonderful. I think we'll wrap up there. We really, you've given us so much information, so many practical tips, and really, really inspiring. So thank you so much, Neha. We absolutely loved it. The comments were just glowing, and everyone found it incredibly thought-provoking. This is a topic that we don't cover as frequently as the health-related topics, but it's super important and super inspiring as well, I think, to integrate it into our practices more and more. So thank you so much. And for everyone who's watching, if you enjoyed this talk, you want to let other people know, they can watch it if they're a member via Plant-Based Health Professionals UK. And thanks again, Neha, and do stay in touch.
Thank you. Yes, stay in touch, everyone. Take care.
Take care. And for everyone who's listening as well, do follow Neha on social media, on Twitter and Instagram and things. I've put all the details on in the bio, so please do have a look so that you can keep in touch. Take care.
Take care. Thank you.